We've been talking today about breast reduction. I'd like to continue that conversation. Let's talk a little bit about how we can get your surgery pre-approved through your insurance, details of the surgery, and then what to expect for after surgery. First, I cannot guarantee that your back and neck and shoulder pain will be completely relieved or alleviated because of this surgery, which is why I like you to see physiatry, Dr. Zacharias. She's a branch of neurosurgery where she'll evaluate your back and your shoulders to make sure we didn't miss another source for your pain. Before you leave here today, you will have her contact information. Once you meet with her, you will then make a video visit with me, and we will discuss any concerns that you have after this visit or meeting with her, and then I'll submit a request to your insurance for approval. Once we have that approval, my secretary Mona will then call you with a surgery date. From there, you'll come back and see me a week or two before surgery so we can talk about these issues again. If you smoke or you're around someone who smokes, we will ask you to have a urine nicotine test or a drug screen to confirm that your urine is clear of any nicotine or marijuana products. This allows for better healing. I will let you know after surgery when it may be safe to restart or be around those people. It will not be immediately. It's typically 6 to 8 weeks before you're fully healed and that you could be around that kind of exposure. But if you've been away from cigarette smoking for this long, it may be something to consider to stop altogether. So let's talk about details of the surgery. I'm going to give you this brochure today in the office, and you can refer back to it later on. This is a procedure I perform in the operating room. It typically takes around 3 hours to perform. You come in, you go home the same day. All the stitches are underneath the skin. I'll make an incision around the nipple, from the nipple to the fold, and underneath. You can raise your arms, you can lift, you can shower and wash over everything. There's a drain or plastic tube that's going to stay in place for a week to 10 days. I will give you a sheet of paper that you'll record the drain outputs. You'll bring that piece of paper into the office with you on your first visit. This helps me know when I can remove the drains. Again, but it's typically a week to 10 days after surgery. It's important for that you're up and moving around after surgery, not laying in bed watching TV or Netflix. Walking around helps to reduce the potential for blood clots. These are clots that form in your legs that go to your lungs and can be potentially lethal. So it's very important you're up and moving around, walking around the house every hour to hour and a half during daytime hours. You'll be given pain medication after surgery, a narcotic called Norco, a muscle relaxant called Flexeril or cyclobenzaprine, and 2 medications that reduce your need for narcotics, one magnesium oxide and another Lyrica. I'll submit those prescriptions to your pharmacy, and you will have them when you leave the hospital. Typically after surgery, I'll put a bra on you after the procedure. It's a soft bra that hooks in the front, and you can continue to wear this, or I recommend going to Amazon and purchasing a soft bra that hooks in the front. This is typically slightly larger than you would typically wear because you're a little swollen, and a tighter bra may be more uncomfortable. After 2 to 3 months, you'll be back into a regular fitting bra. Okay, let's talk about some risks and benefits of this procedure. Because I'm cutting around the nipple, I'm cutting some of the nerves and the blood vessels that go to the nipple, which means the way the nipple feels can be more sensitive, sometimes less sensitive, sometimes it doesn't change. I'm reshaping the breast tissue on top of the chest wall. The breast can feel lumpy or bumpy after surgery. Sometimes that becomes the new normal, or sometimes it goes back to the way it was before surgery. No 2 breasts are identical. You'll always be able to look in front of the mirror and see some subtle differences, but it would never be so much that it would be different in a bra, or that you would need 2 different bra cup sizes. If you were to gain weight after surgery or lose a significant weight amount after surgery, the breasts will change. Ideally, after surgery, it's best to keep a stable weight so the breast size can become stable or remain stable. If you were to have children after surgery, this alters the shape and size of the breast. It's important if you're thinking about doing this that we talk about it. It may be best to wait until after having all the children that you desire before proceeding with surgery so that we can have the most long-term outcome. A few more details for after surgery. Again, we talked about up and walking around. You'll be wearing a supportive bra. There'll be a drain. Typically, people are back to work within 2 to 3 weeks after surgery. It depends on the type of job that you perform, and we will provide a work note for you as well. All right, so these are the details of this surgery. Let's continue our discussion. I'll be right back in and we can talk about any questions that you might have.